It is a huge honor today to be interviewing a real role model of mine, Eric Jackson. I feel like we have so much in common. We're both DDS. We're both masters in the Academy of General Dentistry. We both have our fellowship in International Congress Oral Implantology, and on and on and on and on. And I have really gone to school following you on social media too. I mean, you were the first person I know who you just did it all right. It was your social media posts are educating and informative. I always want to read them, and I can just imagine how your patients wondering. How are you doing today?
I'm doing fantastic. Thank you. Thank you for the kind words. That's fantastic. I mean, coming from someone like yourself with admittedly some of the top posts around, means a lot to me. Thank you.
Oh, hey. And so I want to start off. I mean, there's so many things I could talk to you about. I mean, you're a master clinician. You're an implantologist. You're a successful businessman. You're the top 0.01% social media marketing that I've ever seen, and I've been on social media pretty big time since 1998. You mentioned Invisalign. What are your thoughts on Invisalign, and what would you say to someone who says, there's a couple of companies out there doing it, or do you like Invisalign? Have you tried other ones? Do you think that's a significant part of your practice?
It's like everything else. I never have one part of my practice that's more significant. It's funny. It comes in cycles. You'll get a bunch of implant cases all of a sudden, and then you get a bunch of Invisalign cases all of a sudden, and then you get a bunch of crown and bridge type cases, and it just kind of all ebbs and flows like that. That's what really makes me a very happy general dentist. I like variety. I like being able to dabble in a little of everything. The way I do Invisalign, it's a little bit different. I mean, there's lots of different ways to do it. I don't charge for workups at all. I think it's a really nice service. It's because I'm not doing a tremendous amount of it. I'll just enjoy sitting down after work and then just work up a case. Then I'll have a patient come on back. And I mean, it's a rare treat to be able to sit down with somebody and say, here's what I think visually you can look, and here's what I think your case is going to end up like. What do you think? Because usually, with the orthodontist, in non-Invisalign type cases, it's all between the ears. I can do that in 9 months, in 2 years. But the nice part is being able to really visualize or show the patient. It means the world. It also gives them ownership. They know what's happening. It's no different than a blueprint for your new house that you're going to build or your office building that you're going to construct.
So some orthodontists are not shy at all of the fact that they don't think general dentists should be doing ortho. Has your dad ever told you at the dental table, son, you shouldn't be doing Invisalign? No,
because he instilled in me a long time ago that, and it's very apparent, Invisalign can't do everything. I'm very against Invisalign can just replace braces. And there's plenty of people out there that more or less either say it or, treat like that. You can't do certain movements predictably. That one case that you were able to move, that molar over here to the other side of their face, that's a 1 in a billion shot. And I'm not going to do 1 in a billion type procedures on my patients. I want to know nice traditional tipping, twisting, a little bit of extrusion, that kind of thing. Very traditional. So I'm I'm an old soul when it comes to Invisalign. But the nice part is their technology gets better and better. And when I don't think that it can be accomplished with Invisalign, well, then I've got some beautiful specialists, lined up right there down the street.
Well, Eric, you said you lecture sometimes at your study clubs and stuff.
Yeah, I have.
If you got an hour lecture, I'd give anything to have you put it up on Dental Town.
I'd love to.
Yeah, I would absolutely love that because I just think you're a hell of a guy. You're a hell of a clinician. You're a hell of a social media. I just think you're a hell of a guy. And I just want to tell you, we're 2 minutes over time, but thank you so much for spending an hour with me today. I just think, and thank you for all you do for dentistry and your the CDS Foundation, the DuPage County Health. I mean, everything. You're just a hell of a guy. Thank you so much for spending an hour with me today.
It means a lot coming from a guy like you. You're somebody that I've sat in your lectures and your MBA for dentistry courses and things, and it's just fantastic being able to sit here. This is exactly what I wanted to have when I was young. First year out, second year out, being able to rub elbows with somebody the likes of Howard Farran or the likes of anybody else in that league. I mean, really, we're talking A-list people here, and here I am sitting Skyping with you, and it's fantastic.
Thanks, buddy. Well, thanks, and I hope you have a rockin' hot rest of the day.
You too. Thank you very much.